Welcome, grievers, and I'm so sorry you're here. The Stillbirth Podcast is designed to bring you comfort and information during your loss and prevent future losses during subsequent pregnancies, if that's what you want. I am your host, Ray Jagger, a poet, yogi, and birth educator, and I also have a lost baby myself. Today, we'll be discussing stillbirth loss through the lens of being a medical professional. And our wonderful guest, Susanna Dunlap, is a triple certified nurse practitioner in an ER setting, and she's also a lost mom. So she's here to share her lived experience losing sweet Bethany Kate at 36 weeks to a cord accident. And we'll discuss a little bit about what that means, but basically, usually it's a cord around the neck or cord-related things in some capacity. Her perspective is unique because she serves pregnant people all the time and did after her own tragedy. So we want to hear a little bit about what that's been like. And then also this podcast is uncut and unedited. So sit back and enjoy all the raw feelings and thoughts. And maybe it's not friendly for kids. I don't know. We'll see if there are curse words after you've been warned. Susanna, welcome. I'm so happy you're here. If you don't mind, will you just tell us a little bit about what it was like being pregnant with Bethany Kate, like normal pregnancy?
Yeah, thank you for having me, Ray. I'm really excited in the lost mom capacity of being able to speak about my story in hopes that it'll bring comfort to others. So I really appreciate the invitation. Yeah, so Bethany's pregnancy really begins in January 2020 when Brian, my husband, and I decided to start a family. We felt like we were in a really good part of life, and I had just finished grad school, accepted a job. I was 6 months into my job, starting to feel very comfortable. We had, purchased our home, our forever home, and we were ready to go. So this was 3 months before the pandemic started, and unbeknownst to us, we didn't know that was coming. I didn't know that my workplace was about to become the most stressful environment ever. And in January, I decided I wanted to come off of my antidepressant. That wasn't unsafe for pregnancy, but I just had a mindset that I only wanted to be on vitamins during my pregnancy. Yeah. And just FYI, Chip just picked up his squeak toy beside me. So he squeaks.
Of course, squeak.
Yes. So yeah, I spent about 3 months tapering off of my antidepressant, and that took until March. And then, by the beginning of April, we were fully emerged into the pandemic of COVID-19. Yeah. And we were struggling like everyone else to figure out what's the safest way to practice medicine. How are we going to treat these people? What do we need to do to stay safe and healthy so that we aren't spreading this? And despite having decided to start a family, Brian and I pressed pause. We were like, let's just give it some time. We want to be aware of any situations that could happen in pregnancy if I were to contract the illness. So we paused, and I did become pregnant in September. There was word, in the medical community, there was a vaccine coming out, and I had learned at work how to be very safe with my protective personal equipment, and we felt pretty safe getting pregnant. And we, at that time, did not have difficulty getting pregnant. And it was off to a really good start. I had a very normal 8-week appointment with my obstetrician, was on my prenatal. I had some nausea and vomiting early on in the pregnancy. However, that started to become more and more severe. And I actually was dealing with just severe nausea and vomiting. I was never diagnosed with hyperemesis. I did have a decline in my weight during the first trimester, which I was able to overcome beyond 26 weeks when I finally was able to keep food down. And from 26 to like 32 weeks, everything was fine. Bethany passed her anatomy scan. Every appointment was very reassuring. My blood work was fine. I did not pass my 3-hour glucose tolerance test by just a few points. However, I was fortunate in that I knew how to manage glucose with food choices. And so I did not require medication for that. And for the rest of the pregnancy, my blood sugars were normal. About 34 weeks into the pregnancy, I had an episode of elevated blood pressure and swelling, which subsided after about 2 days, and my obstetrician and I just kind of chalked it up to, I had worked 5 days in a row in the emergency department at 8.5 months pregnant, and I had spent a majority of that time in full PPE, which was an N95, a face mask, a hair bonnet, my scrubs, a contact isolation gown. So I think it was a combination of the stressful environment, because I had not had any other concerning labs regarding blood pressure issues or preeclampsia. So I was never diagnosed with preeclampsia. At that appointment, I did get taken off work because it was becoming quite difficult to be that pregnant in such a fast-paced, high-intensity, high liability environment. And those next 2 weeks went really well. I was able to, nest and finish up the house, get some things together. And the pregnancy, I was feeling good. I had my 35-week, 5-day appointment, and Bethany looked great on the ultrasound. I didn't feel great, mostly because of the physical changes of pregnancy and the, just center of gravity being completely thrown off. And I was quite swollen and dealing with a bit of tendonitis in my wrist. And I was ready for Bethany to be here, to say the least. And it was great. The pregnancy in general was great. I enjoyed being pregnant. I loved my body for the first time in my whole life. I finally felt like I looked the way I was supposed to look. And I really enjoyed the thick, luscious hair and the vibrant skin. Mm-hmm. And the, growing nails. And I loved when people would ask about my pregnancy. It was a very innocent, sweet moment in my life.
Well, that's beautiful. That's beautiful.
Thank you.
So taking into consideration that everything was quote unquote normal or healthy, and I'm using air quotes because there's such a wide range, and this, of what normal is. Mm-hmm. And oftentimes in pregnancy, there aren't a lot of answers as to what some of the abnormal things are. Like, people swell. Sometimes there's elevated heart rate, and it doesn't mean preeclampsia or HELLP syndrome. Like, there's just such a wide range of normal. And that's why it's so difficult sometimes to catch some of these causes of stillbirth, like a small placenta or a cord somewhere, or cord compression is especially hard to know that's happening. So in lieu of a healthy pregnancy, tell us a little bit about how you found out that Bethany Kate had passed, and where you were when you found out, what that was like.
Yeah, definitely. So it was May 17th, and I had spent the morning getting ready, fixing my hair and makeup, and going to attend the baby shower that my work was planning to hold for me. And I went to that, and I could feel her moving around that morning. And then the day just really picked up and got really busy. I finished the baby shower, dropped off the presents at home, and I was texting with my husband, I'm going to go run some errands. And later in the afternoon, I ended up at a close friend's house who was also pregnant, and she was about a month behind me in gestational age. And throughout my pregnancy, I'd had a difficult time anytime I tried to use a Doppler device on myself, because I had an anterior placenta. And it was not uncommon for me to really struggle to find her heartbeat. And I would always just resort to getting an ultrasound, because where I work, it was really quite easy for me to walk over and press the on button. And
that is so nice.
Yes. And so we were playing around with a Doppler at her house, and, we were doing her abdomen, and we immediately picked up her child's heart rate. And then we did my abdomen, and I couldn't find anything, but I was like, oh, I can feel her moving around. But in my mind, looking back, retrospect's 2020, I think it was probably her body just shifting in response to the movements I was making. Mm-hmm. I don't think it was spontaneous fetal movement.
Yeah.
So I went back home, and I don't remember getting anxious or worried, because it had happened so many other times. And I was like, well, I'm going to see the doctor on Monday. If I get feeling bad, I will go in. Well, that evening came, and Bethany Kate was a night owl just like me. And I could always count on a lot of fetal movement right after I would take a bath. So around 9 p.m., I would take a bath and lay in bed, and she would just be like I used to call her like my mature prima ballerina, because it was very long, delicate, majestic moves. It was never like Thumper the bunny baby movements with her.
A thumper.
Yeah. And so I couldn't feel her, and I laid on my side. I drank my juice like I had been coached to, give yourself a little sugar.
Tell you to do.
Yeah. And I actually got quite worried at that point, and I went and grabbed my stethoscope and tried to auscultate my heart tones, or Bethany's heart tones, and I couldn't find anything. And I told Brian, I said, we're going to have to go to the hospital. And he was like, let's just go. And, it was, looking back, it's so heartbreaking, because I think it was that moment that I realized Bethany could be dead.
Mm-hmm.
And I saw Brian like grabbing the car seat, grabbing the packed bag, grabbing her door hanger for the hospital. And I remember driving to the hospital, just rubbing my belly, thinking she's dead.
Mm-hmm.
And I never said anything to Brian on the way there. I kind of knew that when people get bad news, they can't do simple tasks really well or safely to the level that they normally can. Yeah. And that's just in response to me working in the emergency department, having to make difficult phone calls for people. So when we got to the hospital, we checked in. I went right up to, we actually have an OB emergency department in our hospital. It's a small unit managed by nurse practitioners and OBGYNs. And I checked in, and what's crazy to me is I didn't think I would be there for that. Like, it was really bizarre. And I just checked.
No one ever thinks
that. I was like, oh, this is like, maybe this is fetal sleep cycle. Maybe she's outgrown her uterus and placenta.
That's bad misinformation that people get.
Maybe she's too big for me to feel the movement the way I used to be able to.
Now, when you got there, did you say I'm here because I can't find a heartbeat, or did you check in?
Yeah, so I checked in to the OB-ED, and they were, you fill out a form, your name, your birthday, and why you're at the emergency department. So I just put decreased fetal movements. Mm-hmm. I didn't say I couldn't find a heartbeat, because at that moment, that wasn't abnormal in my experience.
Right.
Because I had been at the office many times, and they were trying to Doppler, and they're like, oh, let's see the ultrasound. You've got a anterior placenta placement, so this won't be as reliable. Mm-hmm. So I was just accustomed to, okay, I'm going to check in. They're going to give me an ultrasound. So I just remember looking at my white shoes and my black yoga pants, walking to the exam room. I was looking down over my belly. I had on a gray and white striped shirt, and I got on the stretcher, and the nurse came in with the pink and blue elastic fetal Doppler, the circular Toco monitor device, and she was listening for the heartbeat, and all she could hear was mine. And at this point, my heart rate was like 130, because I was so anxious. And she picked up her little, nurse phone and was like, hey, can you guys go ahead and send ultrasound in? And I knew by this point that something was horribly wrong. And Brian didn't know yet. And he was at the bedside with me. But anytime I'd ever been in the position to have to call for more advanced imaging or whatnot, I knew that something's wrong. I've seen something abnormal just in my practice. So the ultrasound tech came in, and she immediately turned the volume off on the screen, and I could see her focusing in on one area. And she wasn't doing the usual, anatomical tracings that you would normally do for like a fetal well-being scan.
Yeah.
And so she asked the nurse to get the doctor. And at this point, I just started crying, like silently crying, because I knew.
Yeah.
And the doctor came in, and he repeated the scan. And I looked at him and I said, is she dead? And he said, there's no heartbeat.
I hate when they say that. I wish they would just say yes.
Right.
Yes.
Right.
Yeah.
I wish he had too. And the next,
Especially for Brian too. And like
yeah,
when
the next,
something happened.
yeah, like,
Yeah.
because what if someone non-medical is like, oh, well, let's just restart it.
Mhm.
Let's just restart the heart. So I think using the word dead or died or
More direct.
responding directly and affirmatively to families is more helpful in that situation. And I just remember the next few moments, Brian just screamed, no, and he threw his hands up, and then he just kind of fell over on me in the bed, and we were sobbing.
Mhm.
And in my former people-pleasing way, in my former take care of everyone else besides me way, I remember apologizing to the doctor saying, I'm so sorry. I know this is so horrible for you. This is the worst patient scenario ever. And he's like, I'm so sorry for you. This is the worst thing ever. It's like a moment of like, Brian tells me when Brian retells this story, he's like, I can't believe you did that. And oh, it's just me, in a former life trying to manage other people's emotions, not make it so bad on them. I will carry the weight of this.
Well, in a trauma, you also resort back to like whatever is safe for you.
Yes,
and that's
totally.
people pleasing. You go into that so hard. And that's like, you're going back to the most primal function level.
Oh, totally. My prefrontal cortex was way offline and my amygdala was like steering the ship. It was like, here we go. So it probably wasn't as long as I thought, but several minutes passed. It felt agonizing. My sister-in-law was actually the floor above us because this is a women's and children's hospital. She was upstairs with my nephew who had had his tonsils removed the day prior. And she immediately came down. We called Brian's parents, which, as you know, those are horrible phone calls to make. It was my experience that the people who picked up the phone thought that I was in labor or that the baby had been born alive. Because why else are you getting a late night phone call from your pregnant relative, right? And my sister-in-law immediately came down and was crying with us. And the doctor in the OB emergency department said, I'm going to call your OBGYN or whoever's on call for them, and we're going to make a plan for you. Because at this point, I had no idea what the next steps were. I had known one person in my life prior that had a stillbirth, but I did not know the details of the care after their diagnosis of stillbirth. I didn't know what delivery and plan and would I go home, would I stay? I didn't know what that looked like. So fortunately, the physician on call with the practice actually came to the hospital to see me, which I thought was really important. And I appreciated that gesture because really there wasn't anything to do for Bethany at that point.
Yeah.
I was not having a quote unquote medical emergency. The emergency had already happened and she was now dead.
Yeah.
And so he didn't really have to come. He could have given these orders over the phone. He could have completed the consultation and had me admitted, and voiced that through the OB emergency department physician. But I was really glad he came in and he talked to us a long time. I don't remember the things he said, just very apologetic, very empathetic. And he's like, it's really your choice what you want to do. Do you want to stay in the hospital? Your doctor is in the hospital tomorrow. They're assigned to the hospital. They've got a few surgeries scheduled. They'll be here. Or I can send you home and you can come into the office later this week and discuss options with your doctor. And I knew it would not be safe for me to go home.
Yeah.
I knew I wanted to die and I was scared I would kill myself. I really was. I knew that
the first thing that people want to do is like, I want my child to live and I want to die because this is too horrible to live with.
Yes. Or I want to be dead with her.
Yep. I think it's important for people watching this or listening to this to understand that it is the first thing that comes across all of our minds. There is no
absolutely
hope. We know there's no miracle for these babies and we feel so guilty and so horrible. We do not want to be alive. Yeah.
Right. And it's also like just this for me, it was a complete feeling of doom. I was like, how does life go on after this?
Yeah.
What is life going to look like? I was already thinking those things that first night at the hospital. So Brian and I elected to stay in the hospital. And fortunately, we were placed on the women's surgery floor, which is where women go to recover from like a hysterectomy or a tubal ligation or some other gynecologic procedure. There were no babies on the floor. There were no nurseries on the floor. There were no laboring women on this floor.
That's good.
It was. I was really thankful for that because it could have been hit or miss. You know,
Yeah.
sometimes you're just assigned to what room is available, especially in the middle of a pandemic.
Yeah.
When the census is very high and the staffing is very limited. I was really thankful for that.
Mhm.
So we decided to stay in that night and wait to see my doctor in the morning. And the on-call physician was like, I'm going to write you sleeping medicine, pain medicine, anxiety medicine. You just let the nurse know if you're feeling like you need one of those medications. And he kind of talked about, you know, your daughter's still breech on the ultrasound we did today. And I really appreciated him saying your daughter because it's a tendency for physicians and medical providers in intense, sad situations to resort to
Fetus.
medical language that's safe and not emotional.
Yeah.
Like he could have said, you know, the fetal presentation is still breech, but he said your daughter. And I remember that. I remember that distinctly. And he said, your doctor will come in the morning and discuss options with you. I don't want you eating or drinking after midnight in case you do go to surgery. And then we went up to the admission room and I remember being wheeled to that room in a wheelchair and changing into the hospital gown because I was still in my gray and white shirt, yoga pants and white shoes, you know. And that was a terrible night. It was just complete shock. And I felt like I was dying. I felt very uncomfortable that she was dead inside of me.
Yeah.
And my only prayer that night was, I just need to know why. I just need to know why.
Mhm.
Because it was so unexpected. And I wasn't sure if the person in my that I had previously known that had stillbirth, I wasn't sure if they ever got a diagnosis. I hadn't spoken to them in detail about it, but it did occur to me that not knowing would be agonizing.
Yeah. Not having answers.
Yeah, like you've got to have answers. I know, buddy. So Chip knows when I start getting really upset and he wants to be here with me. So
You're so handsome.
he is. He had a haircut yesterday and he's got a new bandana and he's feeling really
Festive.
very festive. So I was just very aware of the things I was feeling, that I've got to know what happened to her.
Mm-hmm.
And not just for the planning for future pregnancies, but I've got to know why she died before we got to meet her.
Yeah.
And I was so scared we would not get an answer. And from a medical perspective of someone who had watched autopsies before, not on children, but nonetheless, I was really scared to have to make a decision to have her undergo a postmortem. I was really scared of that.
Yeah.
I just felt like that would be more trauma for Brian and me to undergo.
Mm-hmm. So you didn't go through one, or?
We did not do a postmortem. Yeah. So the doctor came in the next morning and she was really excellent. I really do deeply care and appreciate my OBGYN's ability to be both empathetic and professional and confident at the same time. I felt very much in good hands, which I know is not the case for everyone. And Bethany was breech, and my blood pressure was still a little bit high, obviously very stressed out. And my heart rate was still very high. I had to be on the heart monitor all night long because it stayed in the 130s and 140s. Just, stress response. But, if you're not an athlete or someone who's accustomed to that, it's about what your heart rate is when you're like at a steady jog. Yeah. So all night I've been jogging. Physiologically, I've been jogging. And she kind of discussed the risk versus benefit. She's like, I'm happy to induce you and let you experience labor. And I definitely think you could deliver her breech. And then there was a discussion of, if she becomes stuck and you have a stasis of labor and you become unstable, we will need to go to surgical options,
Right.
whether that's surgically amending her body to allow passage, or, having me deliver cesarean. And I knew what those were nice words for, and I wasn't prepared to meet Bethany in parts. I was wanting to meet her whole. So I decided to undergo a cesarean section that day. And we delivered her at 12:01 on May 18th. Wait, no, I went into the OR at 12:01 and she was born at 1:01. That was her birth time. So I had it was just terrible in the pre-op room, because I'd been in pre-op rooms before with patients who are about to undergo surgery, but I had never been the patient. I mean, I had my tonsils out as a kid, but I don't remember that, right? So I was the patient, and Brian's just sitting there completely catatonic, right?
Mm-hmm.
And the nurses are coming in and out. And I just want to say my nurses were phenomenal. I don't know if they knew I was a healthcare provider, but I felt very well attended to. And then a nurse came in with a packet, and she's like, "This is our birth packet, and there are some very important decisions you and your husband are going to need to make."
Mm-hmm.
And it had not occurred to me yet that I would either be planning an embalming or a cremation for Bethany. It had not occurred to me that I may need to be in the market for an infant casket or urn, that I would be planning a funeral. And it was overwhelming grief. I think that was when my body changed to adjust to, she's dead. Nothing can be done. These are the next steps. We're going to cut her out of you, and then you're going to decide what to do with her body.
Wow, you hit that acceptance fast.
I don't know that I would say acceptance. It was more like I have to do this to get through this.
Mm-hmm.
The whole time I had the overwhelming sense I was dying. The whole time. My heart was so fast the whole time. I was sweaty.
Mm-hmm.
They did give me some, IV Valium. I was like, make it a low dose. I have to be fully awake for her when she gets here. I've got to be awake and aware the whole time. I don't want to miss 1 second with her. So I had that, and it did help. But I just remember Brian being on the phone with his mom in the pre-op room, and she was already speaking to some of the funeral homes, getting quotes for us. And I just remember being disgusted at the cost of burial, infant cremation, infant products needed for burial, like the casket, the opening of the ground fees. And I was frankly disgusted.
It's shameful.
It's shameful. It is. So we made our decisions. We were going to have Bethany cremated, and our church has a columbarium for ashes to be inurned. And we were like, well, that's the decision. That's it, because I'm not going to be able to, personally, I'm not going to be able to, see her in a casket. That stems from childhood fears of caskets. And I didn't want to have my last image of her in a casket for myself. So we made that decision in pre-op before my C-section, and then also signing forms about wanting a postmortem and what that cost would incur, et cetera, which that did not influence our decision, thankfully. But I was also disgusted at that. Like, how can we charge you to find out why your baby died?
Right.
It just blew my mind. And the next decision was, do you want, the memory making team to come in, the bereavement team to come in, and do you want to have our photographer from Now I Lay Me Down to Sleep come in? And it was just all overwhelming. And the nurse could really tell I was struggling with decision fatigue, anxiety, overwhelmed. And she's like, she kind of took my hand and she said, you want the memory kit.
Mhm.
You want the photos. You don't have to ever look at them, but you might one day, even if it's 50 years from now. And I was like, okay.
Yeah.
So we did that. And I went into surgery and I had a very normal, uncomplicated cesarean section. I had spinal anesthesia. Fortunately, it was 100% effective. It was one attempt. I was really grateful for that. And in about halfway through the delivery, I remember the doctor saying, Susanna, we know why she died.
Mm.
And that was I remember that moment. I remember first asking, has she been born? And the doctor said, yes. And I said, what does she look like? And she said, oh, she's got a head full of red hair. It's so much hair. And I just started crying because I remember dreaming about her red hair the whole time. My husband has red hair. So I was really hoping for a redheaded baby.
Mhm.
And then she said, I know why she died. And it like took the breath out of me, even though I couldn't like feel my body. I just remember an overwhelming sense of relief that my physician said that, because that's the only thing I had wanted the night before was, I just want to know why. And Bethany had a very proximal, which means very near to the belly button, umbilical cord knot.
A true knot.
A true knot. And I said, I want to see it. Part of my brain was like, oh, they probably just tied that so they would have something to blame all this on, right?
I would have done that too.
Right? Like you're just looking for something.
Yeah.
And she said, everything else looks normal. She said, she said, your daughter looks normal. She said, your placenta looks normal. It's normal size, normal shape, normal cord insertion. She said, the umbilical cord itself looks normal. There's normal jelly. There's normal blood vessels. There's just a knot. It's just a misfortune of physics.
Mm.
And I was just so relieved. And then that turned very quickly into agitation and anger. I was like, something so simple has killed my child.
Mm-hmm.
After I was pissed off because there's PG-13. I was pissed off because she and I had survived 36 weeks of working face to face with COVID-19. And we had faced all this nausea and vomiting. We faced this blood pressure issue. And I was just like, to succumb to a knot, it was just gut wrenching.
Fair.
And I immediately knew, just from medical training and practitioner school and nursing school, Bethany died of low oxygen and ultimately no oxygen once the knot became tight enough to constrict the blood flow. And I knew she'd essentially suffocated. And I'd seen adult patients before suffocating, and I immediately thought about her suffering. And in the pre-op room, Brian and I had decided we wanted to meet Bethany in post-op. We wanted the nurses to swaddle her and have her ready for us in post-op. I was very nervous about my husband being in the operating room. He's an engineer by trade. He's queasy with a paper cut. And so I was very concerned about, let's just get Brian and me through this operation. We'll meet Bethany in post-op. That's not what happened. Immediately when they were telling me, oh, she's so beautiful, she's got red hair, she's got, pink lips, which, now I'm like, oh, those are stillborn lips. Like, not every baby has those pink lips.
Right.
It was just niceties of the situation. And they handed her to Brian, and I still think that's been the most beautiful moment of my life, even though she was dead. I finally got to see her. There is so much anticipation about what's your baby going to look like. Mm-hmm. What are they going to feel like? Who do they look like? And that was really beautiful. I'm so glad we chose to see her right then. And my physician did leave. Your physician usually cuts, or midwife cuts the cord pretty close to the belly button anyway, 2 or 3 inches. And Bethany's knot was within that range. So the physician left about 8 inches of cord so I could look at the knot and handle it. And I'm so glad I did that. I did that in post-op and in the, I don't even know what the interim room was called. It was not post-op, but it was like the post C-section room. And then I went back to my 3rd floor room on the women's surgery floor. But I'm really glad she left that there because I go back to that so often.
Yeah.
That touching what killed her was a good way for closure for me. I think not closure, but healing maybe might be a good word. There's no closure to this, but maybe healing or knowing something did this that I couldn't control.
And seeing it with your own eyes.
Yes, absolutely. It wasn't a theoretical hypothesis situation. It was and it was a way to alleviate that huge burden Brian and I were feeling about, are we going to decide to do a postmortem? Are we going to decide to do these things? And that was our answer. At the time, I felt very comfortable with that decision. I have went back and forth in the last, it's been 13 months now since delivery. I've went back and forth on that. Like, should I have done that? Should I have sent her to postmortem?
Yeah.
Right.
It's like you have to make a decision, a very fast decision in the middle of trauma. And you just have to make the best of a horrible situation. And sometimes, there's no going back to make a new decision,
It just all feels like wrong decisions.
Yeah, it's so shitty.
The worst.
All wrong decisions.
Yeah, they're all terrible options
of your life, and you still have to make them.
Right. And you have no idea how you're going to feel about it later. You don't.
There's no way.
Yeah. Why would you? Why would you feel good?
You didn't know you were going to have a dead baby. You never know you're going to have a dead baby. You're not like, I think in a year or 2, I'm going to have a dead baby.
Right.
Even when you're pregnant and you feel decreased fetal movement, because Dopplers give you a heartbeat as long as there's a heartbeat. And that's the very last thing to go, and it goes very quickly. But even if you feel decreased fetal movement, we are taught so many misinformed things by even doctors who just don't have up-to-date information, and babies don't run out of room, but we're told that. So we think are normal when they're not, and it's so shitty, and there's only learning the hard way. I do have one last question about just like, I guess through your lens of being a medical practitioner, how has this changed you as a nurse? And when people are pregnant coming into the emergency room, probably for decreased fetal movement, like, I'm sure that's just a horrible trigger, but how has that changed what you do?
Sure. So I kind of want to talk as well about a bias I experienced throughout my pregnancy as a medical provider. And it wasn't something I was aware of, and I wasn't aware that it was something that could negatively affect me. My OBGYN and I have a great patient-physician relationship. I've been her patient for the past 6 years, and she's very well aware of my academic training and where I work. And looking back, I do think we both shared a level of comfort where I didn't think I needed as much explaining for things as she may have normally given to a person who does not have formal medical training. And this is not in any way to point a finger. It's just, I think there's a bias that exists if you're a healthcare provider and you're seeing another healthcare provider and they know you're a healthcare provider. There may be this pretense that, well, I don't have to offer as many explanations because but the truth is I didn't know what would happen. I didn't know Bethany should continue moving as she had moved the entire pregnancy. I didn't realize that I had to go to the OR or the ED immediately if I didn't detect movement. I didn't know that I could skip the hour drink test,
How would you? Just because you're a medical practitioner
Right.
in one field or you see emergency scenarios doesn't mean you're an expert in everything.
Right, absolutely not. And my specific training is acute adult gerontology health, family practitioner with an emphasis on emergency medicine.
Mhm.
So I have very little formal training on the complications of pregnancy.
Oh,
The
yeah.
extent is in the emergency setting. So pregnant patients who've been in a car wreck, what is my responsibility to the mother and the baby? Or a patient who needs to be counseled on getting an x-ray for their possible broken ankle while they're pregnant. Um, so as far as how it's affected me as a provider, it has affected every interaction with every patient, truthfully, not just the pregnant patients, but the patients who are suffering. I am now able to remember how I felt in the emergency room waiting to get my bad news, and how that was the last moments of my normal life.
Mhm.
And I see patients in that moment. And I'm very aware that what I'm about to say may be that big black slash through your timeline of life where it's the before this tragedy and now we're in the after.
Yeah.
And I have taken it upon myself to become softer, more empathetic in those situations. Not that I wasn't previously, but I'm more comfortable sitting in the silence and pausing and letting that person soak it in, and just being aware that after I say a certain word, cancer, no heartbeat, whatever, they're not going to hear me after that for a very long time. And they're going to need some moments. And it's not I will do them a disservice if I expedite that moment because I'm uncomfortable in it.
Yeah.
That makes sense. So,
Absolutely.
fortunately, because we do have an OB emergency department at our hospital, I don't see very many pregnant patients. However, any pregnant person that comes into our emergency department who's been in a car accident, um, I have to see them sometimes if they're assigned to one of the rooms I'm working that day. I've had a few really terrible. Our OB emergency department is not like a trauma resuscitation emergency department, like where you take someone receiving CPR. It's very much on the side of the labor and delivery floor where people can check in because maybe they have a UTI, maybe they have abnormal period bleeding, maybe they have an ectopic.
Mhm.
It can't be GYN plus something else. It can't be like GYN plus wrist sprain, GYN plus absolutely terrible migraine headache. Any of that comes straight to us. So I do see pregnant patients. Haven't seen a pregnant patient come in with a report of decreased fetal movement, but I have had some very sick pregnant patients who are suffering from HELP syndrome
Mm.
or brain aneurysm or motor vehicle accident, and those are devastating. I will say somehow, maybe it's my really strong muscles of dissociation, um, that I do
But
walk
it
into the
works.
so I do walk into the room and I grab the ultrasound and I immediately am talking to the patient while I'm looking at the baby. And my colleagues have been really supportive of me getting back into that. And I think I have positioned myself to be a responder in that situation because I'd rather it be done right than be done by someone else, which, in future pregnancies, that may be hard for me. Um, but I've very much adapted to, I have this new wisdom and knowledge and expertise that's going to help someone else. And I get to decide when to use that or not. And so far, it's gone well at work to be able to use that. Um, when I leave the situation and the patient is what we call dispositioned, either discharged home, admitted to the hospital, whatever, I do make a conscious effort to debrief. How do I feel right now? What am I feeling right now? Could I have done anything differently for myself or for the patient? And do I need to debrief with the physician? So in our emergency department, the nurse practitioners work right alongside the physicians taking care of patients. And so I've been able to engage with them in a lot of these situations. So I think having that initial moment after the patient is dispositioned to check on me has been super helpful.
Good for you.
Yes, and that's been a learned task.
Yeah, that's
through
not a people pleaser thing.
Right. It's not. It's like, oh, I'll just continue to tuck away all my trauma and issues into this,
Can I get you a coffee? Like, are you feeling okay?
Right, exactly. It's really interesting. I had a really beautiful moment in the emergency room with one of the physicians I work with who I just really adore. I think he's a phenomenal physician and he has the best interest of his patients always at heart. And he's never the person to, knee jerk anything. He's going to take a really good long look at things and really try to get to the bottom of it for patients, which I really appreciate that. So we had a patient come in active labor, and they were just moments away from delivering a baby. And, I just threw gloves on and I went in there and we delivered that baby. And it was a little redhead girl. And,
why?
It was,
Why universe?
I know, right? But I was like, okay, this was meant to be, I guess. I'm supposed to be here. I was offered the chance. A colleague of mine was like, hey, I can come in here and do this. You don't have to be in here. I was like, I feel okay. I feel okay. I think I want to be in here. And the baby was born. It was a seamless, fortunately, it went well, except for the whole fact that her husband had brought her to the wrong hospital. Labor and delivery is down the street, 1 block at the Women's and Children's Hospital, but you see the red emergency sign and you turn in, right?
Yeah.
So other than that, the mom and baby did fine. And the dad, I think, will be okay. This was several months ago, but so many of my colleagues came in and asked me how I was doing after that. And I really appreciated their awareness that I was in there and that I had not had the experience of a live birth before, and that I was able to provide the necessary medical care during that time. I just remember like plugging in the orders to the computer, calling over to labor and delivery. Hey, can you send your delivery team over here? There's a woman in active labor. Like, I remember focusing on the important task. And also I remember looking at it as a lost mom. And I felt really proud of myself that I had expanded my capacity to be both in that situation. Instead of just like dissociating like usual. But it was really a beautiful moment. It was really, really nice. Initially I was like, of course this happens when I'm working. Like, of course, like, sure. Like at this point, I'm just totally prepared for anything doomsday to come at me. Like that's historically been the pattern.
You've already been through the worst thing possible.
Right.
What
Nothing is scary.
Bad.
Right? Nothing is scary.
Okay, I don't want to ask, actually, I'm taking that back from the universe. Not what else is in, please, we're inviting it. Just like what else?
Right. Like no more trials, please.
Yeah.
Like, my card is fully
I'm still learn from this. Susanna, I want to thank you so much for answering some questions, for talking and reliving sort of your experience with Bethany Kate and just how hard that can be on the body and just everything spiritually, mentally, on the body, to just go back through that. So thank you so much for sharing. I hope this podcast finds the people who need it. And if not, is this going to work? Oh no, that way. The bluestcircle.com is just a reference website. There's nothing special to it, but it's a bunch of references for people going through stillbirth, which is a loss after 20 weeks. I probably should have said at the beginning, but it's a loss after 20 weeks. And oftentimes it's in the 3rd trimester. That are the most traumatic of losses because you're just so close to the due date. Many of them are even on the due date, but this little reference website shows you all sorts of organizations that are there for support. There's a music playlist, there are articles, there are YouTube videos, and this is among some of those great resources that parents have going through the literal worst moment in their life. So thank you on behalf of me, but also on behalf of the Bluest Circle, because this story will find a home there.
Thank you so much for letting us, me and Chip here, talk about Bethany Kate. We really love keeping her memory alive and saying her name and letting her shine through in this type of outreach. So thank you also for putting together the Bluest Circle, because it's so hard to find resources in those initial moments after trauma.
Yeah, you go to Google and you find a whole bunch of insulting articles.
Yeah, absolutely.